You may know someone diagnosed with Alzheimer's or dementia. We know there's a huge population here in San Diego, and sometimes they are prescribed an antipsychotic medication. But that may not actually be the best course of action. Joining me now to talk more about this, Dr. Diane Darby Beach. She is a gerontologist. Good morning.
Good morning.
Okay, so first of all, let's lay out the problem. The problem is that these people suffering with dementia oftentimes have what would be prescribed or said to be psychotic behavior. So the natural inclination is to throw an antipsychotic at them. But you say not so fast.
Not so fast. We don't want to just drug people. 40% of people who have dementia and are in assisted living or nursing home communities are on antipsychotics. Oftentimes there's not even a diagnosis, and oftentimes it's not needed or they don't work.
Okay, before we get into strategies on how to cope with it, let's talk about the dangers of just being thrown an antipsychotic. What does that drug do to someone?
For people with dementia, it can cause cardiovascular problems. It can cause cerebrovascular problems. They are more at risk of death than any other population using antipsychotics.
Okay, so let's talk about some of the alternatives that at least should be explored first. And we should also point out, it's, you know, in some cases an antipsychotic is absolutely necessary, but not in every case. So what are some of the other options?
Well, there are behavioral interventions. The key is validation and redirection.
So let's do an example.
So, Sally, resident, was a school teacher. She obsesses and has agitation around needing to get to school every day. And the staff tells her, Sally, you're not a school teacher anymore. You retired 30 years ago. All that does is cause her more agitation. What we want to say is, Sally, you're a wonderful teacher. Your students love you. However, it's Saturday. There's no school today. Let's go get breakfast. So there's a little therapeutic fibbing in there.
Oh, isn't that interesting? Okay, so you call it what did you call it?
Therapeutic fibbing.
No, but you called it something.
Validation and then redirection.
That's it. Validation and redirection. So it's not about confronting these people. Why do you want to agitate them? Why do you want to be right over them?
Precisely. And their ability to reason once they have dementia is gone.
Yeah.
So why are you arguing with them?
Yeah. It's not like a logical conversation anyway.
The customer's always right. The resident is always right. The patient is always right. Validation.
Okay. So let's say we try that with Sally, the school teacher, and that still is not calming her down. That is still not helping this agitation, and it's bordering on a psychotic behavior. Then what do we do?
Well, there are other interventions. Keep the environment calm. Avoid overstimulation. Again, no confrontation. If we do need to use an antipsychotic medication, we want to go slow. So in the minimal prescription, the minimal dose or amount, and then titrate as we need. The biggest thing with all of this is staff training. We need to train our staff not to just go to the drugs.
Okay. I mean, that opens up a whole different can of worms, you know, trying to train a staff from a nursing home. But let's talk about what other rights the person with dementia has, because you brought up something interesting to me before we started about their legal rights to turn down this type of medication. But if somebody has Alzheimer's or dementia, doesn't their sense of reasoning account for any of that?
There's a wide definition of capacity in dementia. It can change from moment to moment. It can change from day to day. But the bottom line is, even if someone has dementia, they have the right to refuse treatment if they want to. And in order to give them an antipsychotic medication, we have to have informed consent.
Okay. And this is such an important issue because I know a lot of people in San Diego deal with this. They have loved ones who are dealing with it, and there is a big conference that you are having on September 12th.
Yes, the Dementia Consortium in San Diego sponsors that, September 12th. It's open to the public. We're also giving continuing education units for staff. There's also a great place in San Diego called Right at Home, a home care agency that provides this training as well for free.
Okay. All right. Dr. Diane Darby Beach, this is such an important topic. We should have you back to talk more about it because I know a lot of people here deal with this. Thank you so much for your time.
Thank you as
We'll
well.
put all the information on the event on our website if you want to attend.